Hello. If the patient comes into the hospital and he is getting admitted into the hospital for treating for getting the treatment as an inpatient into the hospital, so you can also get the record of the inpatient details also. So suppose if the patient before admitting into the hospital, patient wants to know the estimated charges for his treatment, so you can prepare the estimate report also. So for this you can go to the in that transaction module and just you can open an estimate form. So in that you'll find this is all the details of the general detail of the estimate which you need to populate. So from here you can select the patient ID which is already registered from the front desk in the hospital. So just type it out, the patient ID or the name or whatever details you are having, so system will automatically search it out from that details. Now you can, from here you can specify the doctor who is going to treat this patient. I have selected this one. So you can specify other details also like this. In this you can see that in there are other details for diagnostic purpose for this patient, so that it will calculate the exact estimated charges for this patient. If I'll move to into another section called diagnosis tab, in this diagnosis you can specify other details like patient is having blood pressure, so you can specify those details as well. So you just need to specify those details and it will be saved as a record. These are other details. Now if we'll move into another section called hospital tab, here you can specify the hospital code. Suppose if you are having multiple hospitals or they are at multiple locations with their different names, so you can specify those locations or different hospital IDs as well, depending on where the patient is going to be admitted. So accordingly it will be provided populated over here. These are the optional fields. Now in the upper part of the screen in right hand side you will see that this is the status which is given over here, like created, approved, partially approved. You can select it depending on your need. Like suppose if doctor approves this patient to get it admitted into the hospital as inpatient, then you can see now that this inpatient button and outpatient button got now enabled. Now if we'll select another status, so it got disabled. Now if I'll click on this, so it will not get enabled. Now I'll select as approved, so it got enabled again. Now you can specify other details like if it's got any insurance claim, you can specify those claims also, like amount is as settled. If you are giving any photo IDs, you can specify those details as well. Now you can specify the insurance company which is already registered with the hospital or associated with the hospital, so you can maintain the records of those insurance companies. As I'll click on that icon, this insurance companies list will get populated over here like this. So I'll select this one and it will be populated over here. Now I'll select the policy type as fresh. Yeah, and now from here you can specify the probable date of admission for the patient. I will select 22nd of December, and approximate duration of stay, so it is as I've selected as 3 days. Now you can specify the class of accommodation. So here there are different classes of accommodation like general, special, deluxe. So I'll select, as soon as I'll select the general package general class of accommodation, so accordingly system will populated over here, populate the charges depending on those package charges for this insurance company here. So I'll select, as soon as I'll select this general, so as now you can see that all the consulting charges and all the charges for this treatment got populated over here depending on the insurance company's package charges. So it is basically coming up from the masters. So whatever charges you are having with these insurance companies is providing whatever charges to your hospital, so you can maintain those charges in the master form and it will be populated from there. So you don't need to maintain such type of records for each and every insurance company. This is the master from where we have specified all these charges, and you can update these charges as well like this. 200, I'll give it as 200 so that it will be updated and it will be populated over here then again. So you can specify these charges. So this was basically the estimate form, and if you need to print this, you can print it as well. So it will be printed in that format and it will be populated there. So this was the outpatient estimate charges.